Uganda has joined the rest of the world to mark World No Tobacco Day. This comes amidst continued public smoking in the face of the 2015 anti-tobacco law. The provisions had barred the latter as it made it unlawful to sell tobacco-related products or smoke a cigarette within 50 meters from any public facility. The Ministry of Health and partners say they have registered success towards a tobacco-free country.
No sale of these products in places where children are cared for. So we've banned that as well, and I think we're making it a little bit not easy for this child to actually get the product.
Around schools, we don't allow parents to smoke around children, but we have also found that the rate now of young people who are smoking has reduced.
The Acting Assistant Commissioner, Mental Health and Control Substance Abuse at the Ministry of Health, Dr. Hasifa Lukwata, says coronavirus tobacco user patients and non-patients are at risk of getting the virus and die early in big numbers.
Most of the truck drivers are actually smokers. They use tobacco, and this is true. We have had reports from the World Health Organization telling us that people who have been smoking, people who are smokers, people who have had respiratory conditions have had a more severe disease. Severe in that you take a long time to cure, but also you reach a point where you need to be helped.
The Executive Director, Uganda National Health Consumers Organization, Robina Katalitimba, says many youth are taking to smoking because of deceptions in form of advertising and marketing by the tobacco industries. They smoke because the tobacco industry wants them to think that smoking is a cool thing to do.
We are also working very hard to let young people know that these are fake and they don't necessarily mean anything. But also we worry about the bystanders, that there are many people who die from tobacco-related illnesses just because they were standing by.
World Health Organization said 44 million children aged 13 to 15 were smoking. 13,000 people in Uganda die every year due to tobacco-related illness. The Ministry of Health says over 3 million tobacco people exposed to second-hand smoke die every year from lung-related conditions, including 6,000 children under the age of 5. Together with the Uganda National Health Consumers Organization, the ministry has strengthened measures to empower youth to protect themselves from the industry manipulation from tobacco and nicotine.
Nicotine. Once you start on nicotine, you are not likely to stop. And you know how it is. It is addictive, it is like food, it is like you eat chips.
That chemical has effects on your brain and changes the chemistry in there. It produces some hormones, some neurotransmitters. It changes the structure of some neurotransmitters, and somehow your brain can get damaged.
The tobacco industry is increasingly targeting younger people as an emerging and vulnerable market for its addictive products, mainly packaging and marketing through social media platforms. In their campaign to build resilience young generation towards a tobacco-free future, Uganda National Health Consumers Organization will engage the youth on social media platforms to resist tobacco industry new innovation using the dangerous products. Abraham Bwaita Robert, UBC News.